I am Cindy Rubin. I am a breastfeeding medicine doc and pediatrician. This is a little bit about me. It is a really good way to just show what you're talking about if you say all those things that I just said, so that your patient can have a visual of what things are going to look like when they put their baby to the breast to achieve that off-center, comfortable, effective latch. Treatment of the first stages. So we've got the engorgement, we maybe have some plugged ducts, maybe have some signs of early mastitis with some erythema and swelling of the breast. The first thing you want to do is, if there is hyperlactation, which there often is, you want to manage that.